Welcome back to the Faculty Factory Podcast. I'm Kim Skarupski at the University of Texas Medical Branch in Galveston, Texas. Did you know that UTMB was the first medical school in Texas? It was established in 1891. It's the first academic medical center west of the Mississippi. There's your fun fact about UTMB. With me today on the podcast is Dr. Adam D. Wolfe, MD, PhD, my new friend and colleague because he's a Texas guy now for 10 years. Dr. Adam Wolfe is an associate professor of pediatrics. He is the program director for the pediatric residency program. He's the assistant dean of medical education. He is the Jan L. Harrison Endowed Chair in Pediatric Graduate Medical Education. He is the interim division chief of pediatric hematology oncology. All of this at Baylor College of Medicine, San Antonio Christus Children's. Do you also head hospitality, procurement, payroll, HR? Is there anything else there, Adam?
I do what needs to be done, as do most of us in academic medicine.
Amen to that. Well, Adam, thank you so much for being on the podcast. Folks, let me tell you how Adam got here. In addition to being obviously generous with his time and really kind of carve out some time to be with us, I read his article that was recently published with his colleagues Lydia K. Davidson and Caroline Paul in MedEd Portal. And it's entitled Put Yourself Out There, a strategy for effective self-promotion in academic medicine. And of course, that's right up my alley. And I thought, what is self-promotion? We talk about one of the goddesses in our field of faculty development through the AAMC, the Association of American Medical Colleges, GFA, Group on Faculty Affairs, Dr. Luann Thorndike. She has this great talk on the art of graceful self-promotion. So we have at Hopkins, we embedded this concept in our leadership programming, and none of us does this well. We're so happy to toot everybody else's horn, but we think, me, this old brain, oh, I got it at the Goodwill years ago. It's nothing. So I love the article. And again, thank you, Dr. Wolfe, for being here. Why in the world did you do this? Why MedEd Portal?
I think those are really important questions. To take the second one first, I think the difference for anyone who's listening who is not familiar with MedEd Portal as a journal, I think the difference there is that MedEd Portal is one of very few peer-reviewed journals that are geared toward actually putting curriculum in the hands of educators. So it's not it doesn't focus on the research behind the work you do. That's a separate paper in academic medicine. But the MedEd Portal publication really includes as downloadable content all the materials that a teacher would need in order to implement a medical education curriculum. And it's open access, which means you don't need permission to pull things down. It's all published Creative Commons license, which means people can reuse the material, edit it as they wish, usually with attribution is appreciated. But that way you can take what somebody has published and really make it your own. And it's supposed to be plug and play, like download the materials. It has all the instructions for how to do it, and you can implement it in your own institution and it's specifically for medical trainees, students, residents, or faculty. And as a disclosure, I think of MedEd Portal as my publishing home. I've been publishing there since 2016, I think. And then for many years served as a reviewer and now serve as an associate editor at the journal as well. And I have just found it to be a really rewarding place to publish. But really, to answer your question, it's because we can take curriculum that we've designed in one place and make it immediately available to people elsewhere who want to fill a gap in their own curriculum without having to design something new.
Exactly. So important. Thank you, Adam. And so many of us at the annual Group on Faculty Affairs, we have all these wonderful curricula. We built these workshops, these seminars, these dynamic, interactive experiences. And then it's like, oh, can you share it with me? Can you tell me how to do it? Can I get this? Can I get the slides? Can I get the whatever? MedEd Portal. That's the
Yep.
place to do it. It is wonderful. Thanks again, Adam. So tell us about it.
I didn't answer your first question though yet, which was
Why?
why self-promotion. So, one of the things I've been teaching since 1998, since I was a graduate student, and even though I was working in basic science at the time as my primary responsibility, teaching has always been really my thing. I come from a family with a lot of teachers. My mother, my grandparents, my cousin, my sister-in-law, my sister, everybody. So I think I come by that honestly. And the thing I tried to come up with when I had to write an educational philosophy, I tried to come up with an explanation of like what do I like to teach about? And honestly, the through line in both clinical and non-clinical things that I teach is stuff people find hard to do. I really like to approach challenging topics and break them down into ways that can be simple enough that somebody can learn them without a lot of background. So in hematology, I like teaching the coagulation cascade, which most people run screaming from. For just as an example of something people find challenging in non sort of clinical teaching, I really gravitate toward things like communication skills, breaking bad news, conflict resolution, and now self promotion, because those are things that I think are absent in a lot of formative curricula. And I think that people need to develop those skills intentionally if they want to be successful with them. So self promotion specifically became an issue for us. My first year as program director was the summer of 2022. And one of our chief residents, Dr. Davidson, who you mentioned, told me that we had some residents who were applying to fellowship that summer and were really struggling with feeling unprepared for writing their personal statement, for getting geared up for interviews. People get very anxious, trainees in particular, but also junior faculty, I think, get pretty anxious about staring at that blank screen with the blinking cursor that says personal statement, and they don't know how to add words to it, or they don't know how to, what are they going to ask me at that interview? What if they ask me a question I can't answer? What if I pause too long? So we sat down and she and I really sat down and started developing what you have seen in Meta Portal as this curriculum. And my favorite way to teach is interactively. I can give a good lecture, but I don't love lecturing. And so we tried to develop this as a workshop-based intervention, putting people to work using their hands, using their voices, and trying to get their ideas out so that they could be prepared for that next thing. So the whole workshop is built on iterative phases of a 2-minute, 2-slide didactic, then some journaling that each learner does on their own very briefly, and then some group discussion or pair sharing that they use to kind of bounce ideas off of each other. And it's all done in as safe a way as we can. The goal being that the learners come out of that workshop with at least 3 personal strengths that they've identified of themselves. And there's no right answer. They pick the 3 things for themselves and they develop a story, which you mentioned, PAR, problem, action, result. They start by describing the challenge, what did they do to address the challenge, and what was the outcome, either for somebody else or for themselves. And you can tell that story in just a couple of minutes during an interview. And if they know in advance what those strengths are that they want to share with the interviewer, and they have those stories in their back pocket, then there's a lot less hemming and hawing when they get to answering interview questions, because interviewers want to learn from the experiences of their applicants. And this is all predicated on something the AAMC has been saying for a very long time. And med schools are better than residencies at adopting it, but the residencies are doing it too, which is that past behavior is the best predictor of future behavior. So if a medical school is looking at candidates and they want people to be hardworking and dedicated, they're going to ask questions of those candidates that elicit experiences they've had that show that they're hardworking and dedicated. That's a lot different from saying, how would you approach a hypothetical situation? They can tell you anything they want, and it might be true or it might not. But a personal story with a behavior in it will help show the interviewer that that you have that quality. So I want our learners to be able to know what those qualities are in advance, and then that can let them seize the reins of the interview a little bit and guide the interviewer toward the things that they want to put forward.
There are 2 things that are so important to me, anyway, at least, that I heard you say. And the first concept is the distinction between PARs, which kind of we know in this space, problem, action, result. But you said a different word. You said the challenge. And I like that because when I first started working with a coach, 15 years ago, she also, Dr. Laura Schweitzer, by the way, if anyone wants a good coach, Dr. Laura Schweitzer she hit me up on the email. I'll put you with her. She's like, you have to come up with your PAR. And I said, I don't know. It wasn't a problem. These weren't problems per se. I didn't identify there's clearly a problem in the cockpit or in the OR or in the process or in the system here. It was more a challenge that something could be optimized. So I like that you distinguish the fact that because some people feel like, well, it wasn't a real problem. I just thought it could be better or different, or I could somehow recalibrate this to optimize an outcome. So I think that is the first important thing that I heard you say, that don't get buried in the idea of now I have to align my strengths with a problem per se,
Mhm.
rather a challenge. I think that's important. And then the second thing that just so smart about what you said is that I've never heard is backing up and starting with personal strengths.
Mhm.
So it's like a chicken egg thing. When you're thinking about going on the interview, do you come up with some great challenges or problems that you fixed or you were part of that you solved? Or do you say, I am really gifted at my superpower strength is I have an instinctive or innate ability to, or have worked really hard to develop these. That approach, if you identify those top three strengths, I like then points to, oh, and that's evidenced by the fact that this, that, and the other. So I think that's just so smart the way you have made those two distinctions. I love that, Adam.
The publication that we put out there very clearly defines the P, the problem, part of PAR, more broadly. So we do include in the teaching slides, we say this doesn't have to be a problem. It could be a challenge you faced or an opportunity. Those are the three ways we define the P, even though they don't start with P. We should have been more creative with our thesaurus, maybe. But but what that does is it gives the, like you said, it gives the learner an opportunity to sort of graft the story onto the strengths. But if they can self-identify a strength, I'll bet I have wagered everything that they can come up with an anecdote, a story that's
Yeah.
going to illustrate that strength. So it usually works out pretty well for that. The other sort of pro tip that we give them, which is not it's not fleshed out deeply in the manuscript because it's sort of outside of scope, is that we work really hard with our learners on personal strategic planning. We teach them about really identifying their core values, figuring out their mission statement or their why. Why do you do the things you do? And then having some kind of vision, which in this context is, what's your next job? Is it applying to residency? Is it applying to fellowship? Is it applying for a faculty position? And um, when they do that, we also introduce them to the fact that every organization that you apply to has that strategic plan too. And it's probably on their website, at least it should be. So I tell people if they're applying to fellowship or they're applying to join a private practice or to become academic faculty, look at the mission statement and the core value set of the institution you're applying to, and then go back to the journal where you listed all those personal strengths. Pick a few that you think align really well with the place you're applying, because that's the other thing that they're looking for that they won't explicitly tell you. Well, I mean, I explicitly tell our applicants we're doing this, but some don't, that they are looking for values alignment. And so make it easy for them. Show them that you share those values, then tell them a story about how you illustrated that value in your own personal life and how it impacted you or somebody else. So the reason that that's important, which is covered in this manuscript, and I think is not always intentionally taught, is that there are some people who are, because of their color or their gender or many other things, are going to be more or less successful at this, just based on historical and structural biases. And so we have a whole section within here talking about the barriers that women and people underrepresented in medicine might face in effective self-promotion. And for women, for example, there's plenty of good literature that this is not a post-sexist world. Women are much less represented in like dean level positions at medical schools and other kinds of sort of leadership positions. And what that does is if you don't have role models at those levels and then you want to set your vision toward getting to those levels, it's a little bit more difficult to know how. And so part of the reason we teach about aligning your values and your strengths to the institution is because it's harder to brand somebody as uppity or pushy or any of the horrible words that are used sometimes to describe certain people's efforts at self-promotion, if you're doing it in a way that you're like, this is how I embody what the institution says that it wants. And I think that that's really a powerful argument to make. It doesn't fix everything, but I think that that's something that we can do as teachers and mentors and coaches to get our learners more enthusiastic and more comfortable with this work.
Well, Dr. Wolfe, again, that is so critical. And what's valuable, especially valuable about this process and the way you're thinking, is that you're bringing it back to the individual person. And that's the leadership, baking in leadership development and leadership growth and that mindset of knowing ourselves to better manage ourselves. So I really appreciate how you've rolled this process back when we think about career development, that you're not only looking for the institution with the best reputation or NIH funding or big, great patient base and cases and whatever other metrics you're looking at. You're also looking for something that's deeper than that and is, will I thrive there personally? Will I feel engaged? Will I feel like I belong here? Because the mission in the community, our relationships are simpatico with who I am as a human being. And we can all kind of put on a, a false face. We can all act for a little bit. But after a while of acting, because we're just trying to get the chops or learn with this person, or we're going to suck it up for a while, that really erodes confidence and energy. And that's where you get the burnout, right? When we're misaligned with a place, and then, yeah, feathers get ruffled, misconceptions, misperceptions, because we feel innately that there's a disconnect. We're not in sync. So I really appreciate how you are raising awareness to knowing ourselves and making better decisions. It won't be foolproof, but at least that awareness of, I have a sense of why this is kind of rubbing me the wrong way. It's because feeling belonging is really important to me, and what we're doing there is kind of antithetical to that. So I really appreciate that sensibility of what you've done is to take the time to help future generations be mindful of those things. It's super cool.
Yeah. Well, and something that you said there that I think is also I want to spotlight is uh, reputation is one component of why you might choose to go somewhere, but I don't know that it's the most important one from the perspective of a learner. And I got this advice when I was a medical student, and I've tried to share it with as many of our residents as I can. I was, after interviewing for residency at a lot of places, I was really struggling because I had gotten sort of, they're not really supposed to happen, but I got some love letters from certain programs that I figured they were going to be ranking me highly. And I was struggling a lot because the place I really wanted to go, the place I loved, was not a top 20 program at the time. And there were some top 20 programs that seemed to like me. And I went to our dean, who he ran the lab next to mine. So I actually knew him. He became a very close mentor. His name's Brad Schwartz. He's an adult biochemist and hematologist. Um, and I said, am I supposed to just put a rank list together that's sort of in the order that programs have national reputation or funding, or? And he said, Adam, no. He said, I have reviewed faculty applications from hundreds of people applying to work here, and some of them come from top reputed places with tons of funding and tons of reputation and prestige. And all of the papers those people have as new faculty are as middle authors in like a 10 author paper. And I can't tell what they actually did. And then I have other applicants who are coming from places I've never heard of, but they're first author on papers. They have created new programs. They have developed service lines. They have shown leadership qualities. Those are the people I want. He said, what really matters is not where you go, it's what you do when you're there. And I try so hard to pass that along to our residents because I think it's true. I don't want to alienate people at those really great top tier places because they're great for a reason. But I think other places are great too, and reputation is only one piece of that whole picture. So I did want to point that out because I think it's a very important part of how you select where you want to go next.
I love that. That's a Dr. Adam Wolfe quote, folks. There, did you hear it? It's not where you go, but what you do.
Yeah, like
So
I said, I got that from Brad Schwartz, but I'm sure he won't mind that I'm sharing it. So
so what kind of feedback can you share a couple stories where folks would go out in these interviews and come back to you and go, oh my gosh, Dr. Wolf, ABC happened, or you won't believe 1, 2, 3 happened. Can you reflect on, or do a couple stories jump into your memory of where this was implemented and how it kind of turned out well, or maybe even like some not so well anecdotes?
Yeah, I think I haven't had anybody come to me and say, I tried that thing you taught me and it didn't work. There may be examples out there. I don't have those. um, I think a recent one would be we have a senior resident who applied for a fellowship this year, and she changed. This is not unusual or wrong in any way. She changed what subspecialty she thought she wanted to do about midway through residency. She came in thinking it was going to be one thing, and then got some exposure to it and realized that her passion was really a little bit different. And that's totally fine. We wouldn't need residency if people were fully formed academic
Yeah.
physicians coming out of med school, right? So this is the time to do that. But she felt, I think, some imposter syndrome about applying to a specialty in which she hadn't spent 3 solid years building cred, or 2.5 years. Which again, it's not required, but our learners put a lot of pressure on themselves that I try to ease away from if we can. And so she was very anxious about writing her personal statement and also about going on interviews. She got a lot of interviews, by the way. This is somebody who, when she switched her fellowship plans, sought out two. She had to change her schedule a little bit. Sought out 2 rotations to get more exposure to her chosen subspecialty, discovered that we were doing a bad job with a part of it. So the thing she wanted to go into was allergy and immunology. She discovered that we had a lot of patients whose families did not seem to know what to do with their EpiPens. So they were correctly prescribed EpiPens, but she did like a structured survey of a lot of patients and families, found that only 17% of them she found that only 17% of those families and patients could correctly identify how and when to use the EpiPen, which was horrifying,
Yeah.
and developed teaching interventions for our residents for how to educate families, and then also social media interventions to educate the public through the hospital social media channels about how to do that more effectively. And her work got accepted at a national meeting. She got featured on a number of websites. So all that to say, trying to tell her that and I said, I'm not telling you what your strengths are. I'm going to give you some examples. I said, you could tell a par story about this that demonstrates your flexibility, how you changed kind of what you were interested in doing as you learned more about yourself and then developed scholarship out of it. This story could also describe your intellectual curiosity. It could also describe your commitment to advocacy on behalf of the community and your patients. And the reason that these could be different. And the same story, by the way, could apply to multiple strengths. That's another piece of this workshop that I think is really important. And that is why knowing what the values are of the place you're applying is so valuable. So I said, if you're going to a place where the fellows role, it leans very heavily clinical, then I would recommend that you build your par story around your clinical advocacy and your educational acumen. If you're going to a place and a lot of fellowships are very high powered basic science research oriented, lean it toward your intellectual curiosity. Here's how I designed my survey. Here's how I implemented it. Here's how I gathered the data. And then here's all the neat national recognition I got for this work. It's the same story, but if you frame it around the strength that you think that they want to hear about the most, that's going to give you a leg up as you go to do your application. I do exactly the same thing, by the way, when I write letters of recommendation. So I do not have a template. I never start with a template, but for each one of our learners who comes to me and wants a letter of recommendation, the first thing I do is I brainstorm out a list of 3 or 4 strengths that I think that person has that also would be interesting to a fellowship director, or if it's for a private practice job, things that I think that they would want for their private practice job. And then I basically structure my letter around stories of things those residents did in our program and that illustrate those qualities. And I'm very deliberate about it. I say, you want this person in your fellowship because she is committed to clinical excellence, she's an excellent educator, and she's a fantastic researcher. And then I tell stories about those 3 things. And then I say, in summary, she's an excellent clinician, she's a fantastic educator, she's a great researcher. And usually that helps, I think, for fellowship directors to be able to look at it and say, oh, yeah, those are the qualities of the person that I'm really looking for. And so I think that, I mean, those are maybe a couple of, maybe not specific examples. Those are a couple of examples of how one could use this approach. Actually, for a specific example, another one of our residents applied this year to genetics fellowship, and genetics is it's separate. It has a separate match. So she was actually applying on a different cycle. And this is somebody who really found some amazing passions for advocacy while she was a resident in our program. And I know it's not quite germane to fellowship directly, but I chose to tell her story by saying, this is somebody that you want in your fellowship because she is a natural leader and she is a really strong advocate for improving the systems in which she works, which I do think makes for a good fellow. And I was able to say, this is somebody who developed this educational intervention. This is somebody who saw that our healing garden in our brand new hospital was growing weeds. And she came to the hospital leadership and said, can we take this over? And they said, sure. She came to me and she said, can you fund it? And I said, sure. And now the residents run the garden. And it's been presented at a national meeting. And again, there's scholarship. And so I can tell that story in a way that would make a fellowship director say, that's the kind of person we want improving our program, you know? Does that answer your question? I think those are
Adam,
some
you
examples.
are so smart. Yeah, that answers the question and more. And I'm just like bouncing in my seat thinking, what a wonderful mentor, sponsor, advocate, coach, even that you are. And I'm just also thinking, everyone listening to this, I don't have an Adam Wolfe here. So this guy's obviously great. He knows their stories. He takes the time to brainstorm their strengths. Who can help me brainstorm my strengths? Because most people, they just, things that are easy to us, we think are like falling off a log. I've told this story in the podcast many times. I thought building programs and doing stuff was like, it's so easy to me that I thought people look at me and roll their eyes and go, well, anybody can do that. Until a former boss said, no, Kim, that's your unique gift and talent. And I thought, oh, it's so the things that are easy to us that we kind of feel like we take for granted, sometimes those things we take for granted. So we don't think they're special. So how does people listening to this, how can they, if they're too humble or don't see it because it's so kind of, they think it's obvious that everybody can do that, how or where can they go to help someone see those strengths, see those unique, gifted, the talents they have, and then align the stories? Who might they go to find an Adam Wolfe?
Well, okay. So first of all, I have plenty of leaders at this hospital who probably would tell you you don't want an Adam Wolfe at your program because as much as I fiercely advocate for our learners, I speak directly to leadership as well. So there's a flip
Truth to
side.
power. That's a good thing.
However, I don't think I'm being unnecessarily humble here. I don't think I'm the originator of what you're asking for with our learners. I try to create an environment in which they can also support each other. And I think the simplest answer to your question is peer mentorship. And part of the workshop, that's why I said I don't like to lecture them. If I get in front of them and read them a slideshow about this, they're not going to walk out knowing all that much more than they walked in with. I'll entertain them. I can give a really entertaining lecture. I'm not going to lie, but I don't think they learn that much. So much of the time is spent with them, like I said, either pair sharing or in small groups discussing, and it's harder to hide from your colleagues. So if I tell them, take 5 minutes, turn to page 2 of the little journal we hand out a little tiny bound journal. They're like 50 cents a piece. And I say, turn to page 2, and I want you to list out all of your personal strengths. And I have a few people who have already had this conversation with me who can list out 5 or 10 things, which is great. We have a few people who sit there staring at a blank page, unwilling to, even to themselves. I tell them, you're not turning this in. This is just for you. It's completely safe. They still are unwilling to claim those strengths that they know they have. And when I tell them after the 5 minutes, now I want you to go around and share your lists with the table, their peers will correct them in a
Exactly.
nice way. But it'll be, of course, you have strengths. You have this and this and this and this.
Exactly.
And so the reason I have them share is because somebody else at the table might say, well, I think I'm really good at leading rounds. I think I'm really bolstered by my faith. It doesn't have to be clinical, right? I am creative. And then other people could be like, oh, that's me too. And then they start writing them down. So the lists get longer as they go through those discussions. So I think, we are taught, and other specialties are going to be different. So there's a culture in different medical specialties that can make this a little bit different. Pediatricians, which is my area, so this is what I'm used to seeing, tend to be a little bit more humble. when they don't need to be. And as long as it's just humility, we can work on it. What I don't want is for them to be paralyzed by an imposter culture where they feel like I just can't, I don't belong here. I don't know enough. I'm not smart enough. They're going to figure me out.
Yeah.
None of that is true. But that this curriculum is part of a whole emphasis on professional identity formation with an idea toward saying you are good enough. That's why you're here. We picked you. You picked us, and we picked you. We know you can do it. But I think peer feedback is very important in helping people at least say, yes, I am creative. I am intellectually curious. I do have a strong work ethic. I have a great attitude, whatever the things are.
Yeah.
And I give them a short list of examples, but I tell them you may not pick from just this list. You have to make up some stuff too. And then I have them go through and pick the 3 or 4 that they want to make sure come out of either the personal statement they're going to write or the next interview they're going to do, because you don't have to get to all 10 of your list or whatever you have. But I do want them to, the idea of a brainstorm is that it's not a final draft. Just write down anything that comes to mind. It could be wrong, it could be impractical, it may not be what you choose later. Just make a list, and that usually gets them rolling. The other antidote I have found for excessive humility and impostery kind of behavior is preparation. So what I don't want them to do is like go straight from a week of nights in the ICU at 84 hours and then go straight into an interview that they haven't thought about on the next Monday morning. So I want them to, the whole purpose of this workshop is to get them prepared. Start thinking about it so that when you start that interview day, you at least have the confidence of knowing you have certain things you want them to learn about you. And I think if you know that, then it feels more interactive. There's a little bit less of that interviewer versus interviewee kind of power differential. It's still there. I can't take that away, but I want people to feel like they own their part of that interview. And I think that helps too.
To me, if you're stuck asking a friend, gosh, if you had to describe me, what do you think I'm good at? What would you say? Like, what stories would you tell about me? Or if someone were to ask you, what are my top 3? What do you think? So absolutely peer colleagues, close family friends, co-learners, yes. And also, when you're talking about that writer's block, I'm imagining maybe it's not that they don't want to write their strengths, but they can't because they literally think this is just so common, so ordinary, natural. Obviously, we're all the same here. What's unique about me? So I sometimes have pivoted and said, okay, if you're struggling with this, look over, who do you know in this room? You know Adam Wolfe? What are the 3 top strengths of Adam Wolfe? Oh, well, he's A, B, and C.
Yeah.
Oh, Kim
Mm-hmm.
Skrupski? Oh, well, she's clearly 1, 2, and 3. Okay, so what made you see, what would Adam say are yours? Well, I don't know what he'd say about me. Come on, if I had Adam alone, what would he tell me about you? What would Kim say about you? So get the pump primed by the mindset of being able to identify characteristics or qualities in someone else, and then turning that mirror to themselves, say, okay, if I were to ask your mom or your brother or your sister or your partner, what would they say about you? And that kind of gets them kind of thinking about, okay, yeah, this differentiates me from someone. Differentiates Adam from Kim. And therefore, yes, I do have some distinguishing strengths, like the Clifton strengths, or there are tools out there that we know that can help people have the aha moment of like, oh, well, I just thought we're all in school together. I thought we all did that. No, no.
Nope. No, everybody's different. And it's not competition. We're not comparing people. We're just describing them. And so, yeah, I think that's exactly right. And you mentioned before, I think it was Lynn Thorndike's term of graceful self-promotion.
Mm-hmm.
There is a group of faculty educators, and the ones that I know of are out at Drexel, like Nancy Spector and Keandra Lewis. And they reached out to me about this paper as well, actually, specifically because they use a very similar format to teaching faculty, specifically women in academic medicine, about how to promote. And they say graceful self-promotion, again, to try to combat this really mythical notion that women are being uppity if they're trying to self-promote, whereas men doing exactly the same thing are being really aggressive and
humble braggy thing. Yeah.
Yeah. So they use a very similar strategy called STAR instead of we talked about the PAR framework. They use the STAR framework, which is situation, task, action, and result. It's very, very similar. And I only chose PAR because I have more, well, two reasons. I have more experience with it and I like simple things. So when I'm teaching, I try to make things as simple and memorable as possible. But um, all that to say, that to me is the needs assessment that pretty much at every level of training, from medical student all the way through faculty looking for dean positions, I think that these are skills that are not innate. I don't think medical schools really teach them. There's already too much in the med school curriculum. I'm not suggesting we overhaul it to include this, but I think people who are mentoring learners can try to be mindful about what challenges either internally or societally are facing our learners when they go on to the next thing for their interviews, their personal statements, promotions, whatever the next thing will be. And how can we counsel them to think about it methodically in a way that they organically can say, this is who I am. I'm not ashamed of it. I'm not overly humble about it. I'm proud about it. And this is how I'm going to convince the next person or the person evaluating me that my qualities are what they want in that next role. And so to me, that's the takeaway message. I like to think small. I'm not expecting to be able to change a system, but I do want those of us, again, with the privilege to mentor learners, to be able to get them started at an early point in their career thinking about this stuff, because it's not going to get easier for them if they haven't practiced it, if they haven't thought about it in an intentional way.
Dr. Adam Wolfe, yes, thanks for the shout out to Nancy Spector. She's been on the podcast, so if you're curious about STAR and learning more about that, you can look up Nancy Spector's episode on the podcast. Folks, you can see why Adam Wolfe is amazing. Thank you, Adam, for training the future leaders, for making faculty developers who are working with faculties, making our jobs easier, because you are preparing the identity formation. You are equipping the future leaders with these basic principles. So thank you for doing that work for us, laying the groundwork so that not only do they get it, but they have expectations. So they're raising the bar for us in offices of faculty affairs and faculty development, saying, this is important stuff. Let's, carry the mantle. I expect that my institution will invest in me and provide added value by helping me develop my career, providing opportunities for growth and development, helping me learn some more. So thank you for taking that mantle and helping us do our jobs better in faculty affairs. And also, Adam Wolfe, I'm going to make sure, folks, because I'm sure you heard him list all the things that he does: communication skills, how to deliver bad news, negotiation, personal strategic visions, and core values. Oh, yeah, I'm going to get Adam Wolfe back here in the podcast because you're so good at what you do. Adam, I'm going to leave the final parting words to you. And again, genius, amazing. Thank you so much for everything you're doing. And I'll shut up and let you say the final peace out.
Oh my goodness. Well, now you're making me feel a little bit humble, because this is not work that I do by myself. So I would just call out that the paper that you mentioned was also co-authored by Lydia Davidson, who was one of our chief residents and is now a fellow in hospital medicine at Texas Tech in Lubbock, and by one of my mentors, Caroline Paul, who is now regional dean of the Bowling Green campus for University of Kentucky School of Medicine. But I've known her since I was a resident. We shared an office when I was a resident in continuity clinic, and she was one of my faculty preceptors. So there's a continuum there. I like to publish with people that I've mentored and people who have mentored me. So it takes a village to do this kind of work. So I do appreciate the kudos, but I also want to make sure I share that a little bit. And it's just such a delight to be invited. I'm glad people are reading Med Portal. I'm glad that you found this and that it resonated with you. And I hope people take some of these lessons to heart and really try to pass these thoughts along to the next generation who are looking for knowledge. They're looking for guidance. They're looking for insight into how to be successful.
Hi, Faculty Factory friends. It's Kim Skorupski here. Just a quick commercial for our upcoming Faculty Leadership Collaborative Mid-Career Bootcamp. We're hot off the 3-day Faculty Leadership Collaborative Early Career Bootcamp, where we had about 72 assistant professors from around the country and the world Speakers included Doctors Susan Chubinskaya, Nutan Vaidya, Valerie Williams, Bob Tillman, Karma Fouché, Rachel Levine, Hannah Lundberg, Jennifer Haythornthwaite, Susan Matulevicius, Sonali Kandawal, and Kathleen Gamilla Crudo, Josh Polanski, and me. It was so awesome. Well, the 3-day mid-career boot camp for associate professors is April 9th to 11th, 2025, 2 to 5 p.m. Central Standard Time, all via Zoom. The topics for the mid-career bootcamp will include leadership presence and self-management by Joe Losey at Pitt, communicating with emotional intelligence with Alice Fornari from Hofstra, leading organizational change with Susan Chubinskaya right here at University of Texas Medical Branch, conflict management and mediation with Dave Usum from Hopkins, strategic thinking, planning, and negotiating with Rejma Jagzi from Emory, building and managing teams and projects with Wendy Bennett from Hopkins and Darpan Patel from the University of Texas Medical Branch, finances and funds flow with Vin Pellegrini from Dartmouth, and creating a leadership future, preparing for transitions with Archana Chatterjee from Rosalind Franklin. We're also going to have a panel of recently promoted professors who will share their journeys. You'll get 9 contact hours of CME, CNE, and CLS continuing education credits. You've got a curated resource guide, lots of networking opportunities. We have a half hour before, half hour after each day's events for just more community building and networking and Q&A. So go to the facultyfactory.org website. That's facultyfactory.org website. You'll find the link right there on the first page to sign up and share it with your colleagues and friends. Thanks for tuning in to the Faculty Factory podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.